Hi class, this week we're going to talk about the urinary system. So the functions of the urinary system might be pretty obvious. It produces urine. It balances the volume of the body's fluids and electrolytes. And we'll see which organs are responsible for these functions as we go along, as we talk more in depth about them. The organs that are considered part of the urinary system include the kidneys, the ureters, the bladder, and the urethra. The kidneys are located in the retroperitoneal space in the abdomen, which means behind the peritoneum. So we're thinking behind the intestines, behind the abdominal organs in general. The function of the kidney is to filter blood. So a lot of people think of the kidneys as something to do with urine, and it does. It forms urine to be excreted, but its main job is to filter the blood that goes through the body to get rid of all of the toxins. The right kidney sits a little bit lower than the left kidney, and it's a little bit smaller because the liver is on that side of the body, and the liver is quite a large organ, so it has to make room. There are a lot of different parts of the kidney itself. It sits within a fat pad which protects it. The hilum is the part of the kidney where the blood vessels are entering. The kidney also has two main parts, the cortex, which is the outer capsule, and the medulla, which is the inner portion. Inside the kidney, there are renal pyramids, which are these triangular sort of looking structures, and renal columns. And those filter into the minor and major calyces, which are going to be these inner portions, and those filter into a renal pelvis. So all of these structures within the kidney are going to function to concentrate the urine and filter it, and then the urine will collect in this renal pelvis in order to be excreted from the kidneys and into the ureters. The nephron is the microscopic anatomy of the kidney. So this is on a very microscopic level. There are tons of nephrons within each kidney. The nephron consists of a renal corpuscle, a renal tubule, and a collecting duct. The renal corpuscle is going to be composed of the glomerulus and the Bowman's capsule. The glomerulus and the Bowman's capsule together are going to function to be our main filtering mechanism in the nephron. They produce a glomerular filtrate, which is kind of like a blood plasma, that liquid portion of the blood. It's about the same consistency. About 1% of the glomerular filtrate that the renal corpuscle makes out of the filtered blood is going to become urine, so not much of it, because we're going to go through a long process of reabsorbing some of this material and keeping some of this fluid so that we maintain our body's fluid levels. The renal tubule is made up of the PCT, which is the proximal convoluted tubule, the loop of Henle, and the DCT, or the distal convoluted tubule. We'll talk about their functions in just a moment. And then we have the collecting duct. So again, this is one nephron. There are tons of nephrons within each kidney. The juxtaglomerular apparatus is also part of the nephron. It's a tiny little portion right by the glomerulus and Bowman's capsule. It's going to maintain homeostasis of blood flow, and it does so by secreting renin. So when more blood is needed to be filtered through, it secretes renin, which is going to raise blood pressure. It constricts the blood vessels, so they enter this filtering mechanism more quickly. So, like we said, the kidney's functions are to process blood plasma. At rest, it's about 20% that's being filtered into the kidney. It's to excrete urine, balance our electrolytes, sodium, potassium, chloride, and urea especially. It influences the secretion of ADH, antidiuretic hormone, from the brain, remember, the posterior pituitary, and aldosterone from the adrenal glands. So remember, antidiuretic hormone is supposed to influence the body to maintain more fluid. So in this way, the kidney kind of functions as a feedback mechanism for ADH, because when we need to secrete more fluid and get rid of more fluid, it might tell ADH that it needs to stop being secreted by the posterior pituitary. And the same goes for aldosterone. But aldosterone has more of a function with sodium homeostasis, so it can function in a negative feedback mechanism for sodium homeostasis and knowing how much sodium we should be getting rid of through this nephron. It also helps to make vitamin D. It's part of the vitamin D process, and erythropoietin, which is going to help us make new red blood cells, depending on how much oxygen we need to have flowing through our bodies at a certain time. So there are 3 steps to urine formation: filtration, tubular reabsorption, and tubular secretion. During filtration, that water infiltrates are going to move across the renal corpuscle, so across the glomerulus and Bowman's capsule, the blood plasma, and is going to basically be filtered into water infiltrates, and that's going to move across and into the renal tubule, where tubular reabsorption is going to take place. So it's going to take any molecules that are in that tubule from that filtrate that need to be reabsorbed by the body and put it back into the blood. About 2/3 of that filtrate is actually going to be reabsorbed before the end of even the PCT. Different parts of the renal tubule are responsible for reabsorbing different things, but you guys don't have to know that for this class. We put things back into the blood that our body needs, different nutrients. The distal convoluted tubule is going to take any molecules that are not needed in the blood and send it into the collecting duct, where it will continue on to be excreted in urine. So we talked a little bit about ADH and aldosterone already. They're going to target cells in the distal convoluted tubule and the collecting ducts. ADH is going to cause reuptake of water, so when you're more dehydrated, you might have more ADH secretion happening to influence the kidneys to keep more water in your system. If you keep more water, that would result in your urine being a little bit darker because it'd be more concentrated with filtrate rather than the water that normally would have been there. If ADH isn't functioning as much and isn't needed to keep as much water in your body, you might get rid of a lot more water through your urine, and it might look more clear colored or like light yellowed colored. Aldosterone is going to increase the activity of the sodium-potassium pump. So remember that aldosterone is responsible for sodium homeostasis, maintaining the correct level of sodium in our bodies. ANH is a hormone secreted by the heart, and it actually acts as an antagonist for aldosterone. And through this process, it will also help to get rid of more water. It actually acts as an antagonist to ADH as well. Your ureters are going to be the next part of our urinary system. So they're going to carry urine that has been concentrated and filtered by the kidneys and transport it to the bladder. So ureters are 28 to 34 centimeters in length. They're composed of transitional epithelium, which means that they can change shape depending on pressure. In men, they are really close to the prostate, which is going to be important in conditions like BPH, benign prostatic hypertrophy, when men's prostates get too large. The ureters might be compressed if the prostate gets too large, which would cause kind of a stoppage of the flow of urine. The urinary bladder is our next stop. It's going to rest right on the prostate in men, and it's anterior to the uterus in women. So again, in cases of BPH with the prostate, the bladder can be affected negatively. So you might not be able to hold as much urine in the bladder. And it's the same with pregnancy. With the urinary bladder sitting anterior to the uterus, as the uterus expands, it's going to compress that bladder. And then that's why pregnant women have a tendency to have to urinate quite often and feel that pressure on their bladder. The bladder has a detrusor muscle, which is a smooth muscle in its wall, and it's going to help it with contraction during urination. It also serves as a reservoir for urine while it's waiting to be excreted. The urethra comes from the bladder. It's going to be shorter in females and longer in males. So females have a urethra that's about 1.2 inches, and males it's about 7.9 inches. So that's clinically significant in the fact that if you've ever heard of kidney stones, the reason why women often could have kidney stones and not feel them is because their urethra is a really short distance. So the kidney stones have a lot shorter distance to travel in women than they do in men. The urethra in men passes right through the center of the prostate. So again, in conditions like BPH, you can get men can have a hard time urinating or starting and stopping flow of urine. So the urethra in men is going to be the same tract as the reproductive tract. So it's going to be joined by ejaculatory ducts and exit through the penis through the urethral meatus. But in women, it's separate from the reproductive tract. There are two separate orifices. So in women, they have a urethral meatus, and then they'll have a vaginal orifice. Micturition is a fancy word for urination. So generally, this happens through involuntary contractions of your detrusor muscle, that muscle in the bladder wall. Oftentimes, you don't have to physically think about urinating, but you can voluntarily contract the bladder as well. However, that's not possible until the nervous system is completely matured. So when small children are getting potty trained, until their nervous system is fully developed, they won't be able to voluntarily contract their bladder or be able to, hold their urine. So they won't be able to keep that internal urethral sphincter closed. So just like all the other organs we've talked about thus far, it's going to have an internal sphincter, that internal urethral sphincter, and that's going to, when it relaxes, that's when it's going to release the urine down the urethra to be excreted. So urine is about 95% water, but there are a lot of things that can be within urine. Generally, there's a lot of nitrogenous waste, like urea, uric acid, ammonia, and creatinine. Those are usually components of muscle breakdown. So the more urea, uric acid, ammonia, creatinine you see, your muscles may be breaking down. It's a normal process because with different levels of activity, muscles may break down, or you might see muscle products in your urine if you are exercising a lot and not taking in a lot of protein. If you see a lot of uric acid, high levels of uric acid in the urine, that can be a sign that you have gout, which is a disease of these crystals being in your joints, and it can cause a lot of long-term problems. You may also see different levels of electrolytes in urine, toxins, because the kidney's filtering those out. So if you take medications, components of those will be found in the urine. Pigments, especially urochromes, which is going to give the urine that yellow color. And the urochromes are made by the breakdown of red blood cells, so again, through the filter of the kidney. You may also find different levels of hormones in the urine depending on if somebody's on hormonal medications or has a specific disease pattern that would release hormones into the urine. You may also find abnormal constituents of the urine. If you find blood in the urine, that might be a sign that you have a kidney stone or some kind of infection. Glucose in the urine is a good indicator of diabetes. Albumin is a sign of some sort of disease process happening in the kidneys. If you see casts in the kidneys, usually these are referring to white blood cell or red blood cell casts, which are just accumulations of these cells. That's a good sign of some sort of infection, generally in the kidney. And calculi or stones. So if you find stones, obviously that's a sign that somebody has kidney or bladder stones. The total amount of water in your body is going to vary between 45 and 75%. Males have more water in the body than females, and that is due to having generally a higher muscle mass and smaller fat percentage. Muscle contains more water than fat does. The amount of total body water is going to decrease with obesity and with age. So those who are heavier and are older need to intake more water than the average population in order to maintain a relatively normal total body water volume. Dehydration can occur for a lot of different reasons. Hyperventilation can actually cause dehydration because you're losing water through the vapor that you're breathing out. Any other excessive loss of water through vomiting, diarrhea, sweating. People who are burn victims have also lost a lot of water because the water has been retained in their skin, and a lot of those layers of skin can be sloughed off during burns. Symptoms of dehydration can include thirst, muscle weakness, kidney failure. It can be really serious long term. It can result in death. You can test dehydration by testing skin turgor. So if you are to pinch the skin right above your knuckles on your fingers, if it returns back to your finger really slowly, that's a sign of dehydration. If it snaps right back to your knuckle, that means that you are well hydrated. Edema is an accumulation of fluid in the body. It can occur anywhere, but the lungs, brain, and legs are most vulnerable. Edema can be a sign of a lot of serious diseases, especially congestive heart failure. This is when you would find a lot of edema in the lungs and also in the legs. Pitting edema, like is shown in these pictures, is when you can press your finger into a spot that's edematous and you would leave a fingerprint behind. It has that much fluid in it. Kidneys are semi-vital organs. You definitely need at least one to survive, but you can live with just one kidney. As we know, the kidneys are highly vascular because you have to be able to attach these kidneys to a blood supply in order for them to filter your blood. So the donor kidney its renal artery and vein are going to be connected to the recipient's iliac artery and vein, because they have to take out the diseased kidney's renal artery and vein when they remove it. So it's going to be attached a little bit lower down. So that's it for the urinary system. Let me know if you have any questions, and make sure you read the chapter that goes along with this in the book.